Hi, my name is Cynthia Jester, and I'm with United States University FNP program, and this is a body video for the abdomen. I'm going to start my room scan, and today is 9/23/24, and I'm going to start now. Okay, the ceiling and the floors. I have washed my hands and sanitized them. I have made my patient comfortable. I put a pillow up under his head as well as up under his feet. And now I would like for him to introduce himself. But first of all, I'm going to ask him, do you give your consent for this video to be uploaded to YouTube for grading purposes?
Yes, you have my consent to have this film uploaded for grading purposes.
Okay, can you tell me your name?
Mr. BW.
And what is your date of birth?
12/14/55.
Are you having any pain or discomfort?
No.
Okay. All right. I'm going to start the assessment by assessing his abdomen. I have his shirt pulled up. I've got him covered for privacy. And I'm going to make an observation. I'm inspecting his abdomen, looking for any varicose veins, for any signs of ascites, any varicose veins, discoloration of his skin, any jaundice, any hyper movement of the skin from increased peritonitis. Okay, he's got no jaundice on his skin. I'm going to look at his eyes. If you could open your eyes, and if you could look up, and if you could look down. And he has no ichness in the eyes. There is no jaundice. So I will start the assessment by osculating his bowel sounds. I'm going to osculate all 4 bowel sounds: the lower right quadrant, the upper right quadrant, the upper left, and come down to the left quadrant. I'm going to use the stethoscope, I'm going to use the bell, and I'm going to use the diaphragm. And I'm listening for any type of a bruit, as well as his bowel sounds and the quality of his bowel sounds, the pitch. Okay, I'm just going to listen to your stomach. Okay, he's got bowel sounds. There are no bruits in his right lower quadrant. I'm moving up to his right upper quadrant, and he's got bowel sounds. There are no bruits. I'm moving over to the left upper quadrant, and he has bowel sounds. He's got no bruits. I'm moving down the abdomen over to the left lower quadrant with the bell, with the diaphragm. He has bowel sounds. With the bell, he does not have any bruits. His bowel sounds are normal. They're gurgly. They've got a good pitch. They're just kind of rolling through the abdomen. For normal bowel sounds, it would be 5 to 30 a minute. If it was hyper bowel sounds, it would be more than 30 bowel sounds within a minute. And with hypo, he would have less than 5 bowel sounds within a minute. Now I'm going to listen to the arteries in the abdomen. I'm going to start with the aorta and I'm going to work my way down. The aorta is just a little left of the umbilicus cord. And I'm going to listen with the diaphragm. I'm going to listen with the bell. There is no bruits. I'm going to move over to the renal artery with the diaphragm and with the bell. There is no bruits. Over to the left renal artery with the diaphragm and the bell. There are no bruits. And I'm coming down to the iliac arteries with the diaphragm and the bell. There are no bruits. Going to his left iliac arteries, there's no bruit. I'm using the bell and I'm using the diaphragm, and I'm coming over to I did aorta, I did the renal, I did the iliac. Doing the right and the left iliac with the bell and the diaphragm. There are no bruits. And then for modesty, I'm not going to pull down the blanket any farther to osculate the femorals. I'm just going to place the stethoscope on top of the covers and verbalize that there are normal pulsations. There is no bruits with the diaphragm and with the bell. And I would go to the left side and I would do the same thing with the diaphragm and with the bell. There are no bruits within the abdomen, so there are no problems with aorta. But if we were in a clinical setting, the diaphragm and the bell, it would be skin to skin. So now I'm going to move on and I'm going to do palpation, percussion. I'm going to take my third finger, I'm going to place it on the abdomen, and I'm going to strike it with my second hand. And I'm listening for tympathy all the way throughout the abdomen. Okay, you have any pain?
No.
Any pain?
No.
Okay. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay, so he has tympany all throughout the abdomen. I'm going to move on, and from percussion, I'm going to do palpation. I'm going to do light palpation just with my right hand, and I'm going to kind of knead it a little bit just to see is there any fluids, is there any mass or any fecal matters. And I'm going to do this all the way around the abdomen. It's nice and soft. Are you having any pain?
No.
Okay, it's not tender. Okay, and so now I'm going to use both hands and I'm going to do deep palpation. And with deep palpation, you can feel the organ structures if they are enlarged. So I'm going to start with the right lower quadrant, and with both hands, just going to push. Okay, and I'm going up to the right upper quadrant. And for deep palpation, it would be 5 to 8 inches. Okay, anything? Any pain or anything?
No.
Okay, I do not feel any enlargement of his organs or anything. So now I am going to palpate the liver span. And I'm going to pull the t-shirt up. I'm going to start at the nipple line, and I'm going to percuss down until I hear dullness. Okay, I hear it right about there. Okay, and now I'm going to palpate up the abdomen superiorly until I hear dullness. Okay, all right. And this right here would be my liver span, and I would say that that's about 6 inches. So from 6 to 12 inches is normal in a woman. A liver span of greater than 7 could be considered abnormal. So I've done the light palpation, I've done the deep palpation. We've listened to all of the arteries in the abdomen. And so now I'm going to feel for the liver's edge. So I'm going to come down mid-clavicular to the end of just the bottom rib. Take a deep breath and hold it. Let it out. Okay, I feel the liver's edge, and it's nice and it's smooth. If it was rough and jagged, that could be a sign of some type of disease like cancer or whatever. But the liver is nice and smooth. And while I'm here at the liver's edge, I'm going to do the Murphy's test. I'm going to cuff under the rib with deep palpation, and I'm going to pull back. And if the patient was to have sudden pain from the rebound motion of the skin retracting back, that could be a sign for cholelithiasis. So now I am going to palpate the bladder, and I have had my patients empty his bladder, so it should be tympany. If the bladder was full, it would be you would hear dullness. Okay. Okay, and I hear dullness because the bladder is empty. And so for his spleen, since my patient does not have any disorder, this is a well examination. The spleen is not palpatable without some type of disease process. So the spleen is not palpatable, but if it was, I would come down to the axillary line, and it would be about at the 9th rib. But there, I don't have to palpate it because there is no problems with his spleen. And I'm going to do another test. I'm going to do the water wave test, and that's going to test for ascites. So I'm going to have my patient put your hand right here, down the middle. Okay. And so with this test, it's a water wave test. If there is fluid in the abdomen, as I put my hand on the opposite side of his flank and I tap on it, the water will travel across the abdomen and it would hit my opposite hand. And so that would be positive for ascites. And I would do the same for the right side. I would put my hand and then I would tap it. And if the wave was to hit my hand, that would be a positive sign. I'm going to do the McBurney sign to test for appendicitis. And so that would be about 2 inches inferiorly to the iliac crest. So I'm going to put my hand in deep palpation and pull it out. The patient did not experience, did you have any pain?
No.
He did not experience pain or discomfort, so that would be negative for the McBurney's test. And now I'm going to check him for CVA tenderness. Can you sit up? You just have to sit up in the bed. I just need your back. Okay, I would come down to about the 12th rib, and I would make a fist and gently, firmly strike on his back. Did you feel any pain?
No.
Okay, and there's no pain on the other side. And if there was pain, that could be positive for polynephritis. And that concludes the video for abdomen. Thank you very much.